Today I'm going to talk about red flag signs which parents should know about serious bacterial infections if the children have a fever. Usually fever episodes in children are most of the time benign viral illnesses and they are self-limiting. So if the child is active during the intercurrent illness, if he is eating well, playing, passing urine nicely, so you don't need to bother at all. Only minority of the children will have a serious bacterial infections for which you need to know about the red flag signs. What are serious bacterial infections? Serious bacterial infections are which involve the vital organs like brain, we call it as a meningitis or meningoencephalitis. Similarly, infection in the lungs, like pneumonias or in its complications, and infections involving the kidney and urinary tract, may it be simple urinary tract infections or its complications like pyelonephritis, or infections of the bone, we call it as osteomyelitis. Similarly, if there is a pus collection in the joints, we call it as a septic arthritis. All these may or may not have a bloodstream infections, we call it as a sepsis or bacteremia. So what are the danger signs parents should be aware of if their children have a fever to recognize these serious bacterial infections at early stage? So any child who has a temperature above 104 Fahrenheit or fever persisting more than for 5 days and they are irritable or have an inconsolable cry, and children who has fever who are extremely drowsy or sleepy, if they have any seizure or fits like symptoms, or if they are making any abnormal movements of the limbs or they are not moving at all, and if they have any vomitings, whatever they are eating, or if they are not eating at all, and if they have any headache, also if they are breathing very fast or there is the indrawing of the chest, or they are making any audible sounds while breathing, and also if they are not passing urine adequately. If suppose you can say if you are using nappies, less than 6 nappies per day is less amount of urine they are passing. Similarly, if they have a cold peripheries or non-blanchable rash over the body, or if they have any swelling or in the joints or sore joints and they are not able to move the joint or fixing the limb, not able to move it. If they have any swollen joints or they are not moving the limb, so we need to be concerned about the serious bacterial infections. And one most important thing is children who are less than 3 months old, their immunity is still developing. So these children are very much prone for serious bacterial infection. So even with or without these red flags, it is advisable to review with the pediatrician if they have a fever and then get appropriately investigated.